Hi everyone, Dr. Caitlin Maciejewski with Executive Park Eye Care. Today we're going to be talking about diabetes. This is a disease that affects millions of people. My uncle was actually a type 1 diabetic and lost his vision and ultimately his life to his disease. That's why I decided to become an optometrist. I wanted to try to catch those problems and get it treated before it caused that loss of vision. So let's go ahead and look into it a little bit more, okay? Currently, there are about 23 million Americans affected diabetes, with an annual increase of roughly 1.5 million. The American Diabetes Association believes there is another 7 million who have diabetes but are undiagnosed, and 84 that are considered pre-diabetic or borderline. The American Diabetes Association has found that diabetes is the leading cause of blindness and the 7th leading cause of death. Now, diabetic retinopathy is the most significant ocular complication, but there are others, so we'll take a look. You might have fluctuating or blurry vision, occasional double vision, night vision issues, flashing lights, floating spots, earlier onset for cataracts, glaucoma, strabismus, which is an eye turn, and decrease in corneal sensitivity. There might be a change in your glasses prescription, so how far-sighted or nearsighted you are, or if you need glasses for reading and up close. Now, of course, that can be corrected for with glasses or contact lenses, but it might fluctuate from one day to the next, dependent on your blood sugar. Now, with contact lenses, we do become a little bit more concerned about any decrease in corneal sensitivity. There might be an ulcer that's developing on your eye, and you don't know because you can't feel the typical pain that people have. So if you have any redness or discharge, make sure you get in as soon as possible. Some basic eye anatomy here. The front of the eye is called the cornea. It's a clear dome. That's when we get concerned about any decrease in nerve function. Now the light travels through the pupil here, hits the lens, which gets cloudy over time, and comes back here to the retina. Now, all of the information from the retina gets transmitted through the optic nerve, and it goes to the brain where the brain processes it. Your central vision is right there in the macula, and then the retina is fed by blood vessels. So any elevation in blood sugar over extended periods of time will cause damage to your small blood vessels. This will cause them to start to leak, bleed, and become blocked. That will cause swelling or ischemia to the back of the eye, which damages that retinal tissue. That decreases the ability of the retina to pick up light and process, which decreases your vision overall. Diabetic retinopathy can lead to permanent vision loss and blindness, especially if not treated promptly. So early diagnosis is very important. Different stages of diabetic retinopathy. We have non-proliferative and mild, moderate, severe. That all depends on how much bleeding or areas that aren't getting oxygen appear in the back of the eye. Now you can have diabetic macular edema with both non-proliferative and the proliferative stages. That's when we have swelling behind the macula, which is again where your central vision is. That can cause some distortion. Now ischemia of the macula means that it's not getting oxygen that it needs to survive. When we get to more advanced stages of the diabetic proliferative retinopathy, that's where we start to have, again, some more not life-threatening, but vision-threatening concerns, and it can cause sudden vision loss. So proliferative diabetic retinopathy, and I'll show you that, I believe, on the next slide, is when you have blood vessels that start to grow throughout the retina. So some of the symptoms you might have are absolutely nothing. You might be 20/20 and completely unaware that there's complications. Some people notice a slow decrease in their vision, significant floaters, kind of like a rain shower of spots in your vision. Some people have a complete and sudden vision loss or distortion in their vision. Blind spots are something else that people might notice over time. So with the proliferative retinopathy, like I was saying, there's little blood vessels that start to grow, and it can happen anywhere inside of the eye. Now those little blood vessels right here on the optic nerve, they're weaker than our normal blood vessels and more prone to bleeding. Now we have some of those hemorrhages and everything out here already. So this is someone who has significant proliferative diabetic retinopathy. some of the different stages so you can see the transition. This is a normal, healthy eye. This is just kind of background basic diabetic retinopathy. It can become more advanced and we have more significant bleeding here, areas that aren't getting oxygen. And of course, any area that doesn't get oxygen kills the tissue. We get to severe non-proliferative diabetic retinopathy, and you can see that there's a larger hemorrhage here in the eye. And then we get to the proliferative stage where we have the blood vessels that are growing and again, more intense bleeding. Some people, they start to develop a lot of scar tissue in the eye because it has become so significant. Treatment. If you have non-proliferative retinopathy, we just monitor unless, of course, you have some macular edema. So we want to make sure that we're following you closely with your primary care provider for your tight glycemic control. We might see you annually if it's mild, but we might see you every 6 or 3 months if it is more severe. If you have proliferative retinopathy, we are going to be sending you to a retinal specialist, and they will determine if it's more important for you to have laser surgery or an injection in your eye. This limits any progression and decreases that macular edema. So the different procedures that retina might perform are laser and injection. The theory behind the laser treatment is they kill the peripheral retinal tissue, telling your body we only care about this central area, which is where our central vision is. That lets the body know that I don't have as much tissue to support, and so it kills tissue to save tissue. Now, when our body isn't getting enough oxygen, it tells it to release a chemical called VEGF, and that helps it to produce those extra blood vessels to provide the oxygen necessary. So the specialist will inject anti-VEGF into your eye so that it tells the body, I'm actually doing okay with the support that I have now, and I don't need all of those extra blood vessels that leak more. So don't forget to have your annual diabetic exam, and if you aren't a diabetic, make sure you come in regularly so we can make sure that there's no complications. Oftentimes your eye exam is the first place that we will notice complications of diabetes. Give us a call and schedule your appointment. If you have any questions, let us know.